not just straight, right? Usually for the elbow, 3 positions. I'll go completely straight when I add my valgus load. I'll go about 10 degrees and add it again. And then for the elbow, I'll usually go as far as almost up to 90 or maybe a little bit less and test again there, right? So you can really test all the different fiber portions, the obliques, the straight of that UCI, right? Does that make sense? So don't just do, when you're doing your orthopedic test, don't just be like, boom, right there, oh yeah, feels fine, okay, he's good, right? Because I've done that before, and you go here, and it's like, okay, I'm completely fine, like that's good, doc, I don't feel anything. And then I come up here, and they're like, oh, yeah, what are you doing here? Like, that's killing me, right? So you gotta test the fibers in multiple planes. So when you tape it, you should tape it that way too, depending on what you find orthopedically, right? So if we want to protect all the fibers, we'll do one, just do one tab, right? And again, we want to use tough skin so that it'll stay really well. Look at tape does not stretch. Say that into the camera. You're going to palpate, right, for the joint line. Come down on to the ulna, okay? That's where I want the center of my tab. And then we're going to do 2 strips to pull it up, right? One for the more straight fibers and one for the oblique fibers. So the first one will have him pretty much locked out, straight. Okay. And you know, we're holding, we're pulling hard, you get those ripples, just coming up onto the humerus that way. And then the second strip, I'll put him in a little bit more flexion. Not all the way up to here, because then it just kind of gets awkward. But I'll put him in a little bit more flexion, and I'll turn it more obliquely, and come up, kind of pulling the humerus up, or the ulna up and across onto the humerus that way. So see, it's kind of fanned out